Oh, that'll be on the tape.
Yep, it will be.
All right, you recording or no?
Yeah.
Okay, so this is everything on OI. So OI is osteogenesis imperfecta, otherwise known as brittle bone disease. Did you know that 1 out of every 10 to 20,000 people are born with osteogenesis imperfecta /OI throughout the world? That's roughly 0.01 to 0.02% of the world's population. Although this may seem like a small percentage, that accounts for nearly 50,000 people in the United States of America. Children and adults born with OI have many complications throughout their lives. These challenges include the symptoms they endure, the diagnosis, treatment options available, and how they inherited OI in the first place. For 100 years or more, there have been countless registered OI cases throughout the world. This is a heavily researched topic and has many valuable sources for information. These sources are exhibited throughout the presentation. Firstly, what is OI? Osteogenesis imperfecta is a rare disease that is also more commonly known by the name of brittle bone disease. NIH states osteogenesis imperfecta is a genetic or heritable disease in which bones fracture easily, often with no obvious cause or minimal injury. National Institute of Arthritis and Musculoskeletal and Skin Diseases. OI is notoriously known for leaving the afflicted with many breaks or fractures of their bones throughout the body. Type 1 collagen is a material in bones that helps make them strong. The defect in the genes causes the body to make collagen incorrectly or not enough. NIH correctly assesses the reason why people have OI have bones that break easier. This is due to the collagen gene. There's two. There's COL1A1 and then COL1A2. It's just collagen genes, and they make up your bone structure. Yeah, you can flip it. So this one is a healthy bone. It's very compact, but this is with brittle bone disease. It's all like loose, and that's because you're not getting enough collagen in your bones, and so it's making them easier to break. Secondly, there are many different types of osteogenesis imperfecta. The most frequent types are from type 1 to type 8, although there are 19 total recognized variants. NIH said type 1 is the mildest and most common form of OI. Type 2 is the most severe form of OI. Type 2 typically results in death shortly after birth, as most children born with it don't live long, just because of complications. Type 1 and type 2 are the most common of the types, as the majority of people fall into these two categories. As Medline Plus writes, additional features of these types can include blue slayer of the eyes, that's like the white part of your eyes, it's blue, short stature, curvature of the spine / scoliosis, joint deformities, hearing loss, respiratory problems, or mobility can be reduced in affected individuals, and some may use a walker or a wheelchair. There are many different symptoms to diagnose with osteogenesis imperfecta. OI has many types of the disease as well as different types of diagnosis and treatment, although treatment options are very limited. Thirdly, there is no cure for OI, as people born with it are carriers of the disease until death. Because of the nature of the disease, there are very limited treatment options for osteogenesis imperfecta. Some options Mayo Clinic gives are biphosphates, denosumab, hormone-related therapy, and bone-building medicines. These are some of the most successful treatment options. Although they won't take away the disease, they will lessen the breakage and improve overall lifestyle. Biophosphates are drugs that can help to strengthen bones and reduce the risk of bones breaking, Cancer Research UK writes. Biphosphates medicines are widely used for most cases of osteogenesis imperfecta with high success rates, but these success rates unfortunately pair alongside with many side effects like nausea and heartburn-like symptoms. Yeah, you can. So this is type 1 to type 4. Those are all, type 3, and then those are type 4. As you can see, there's a whole bunch of different symptoms that are going on. These are their bones all deformed, and probably all of them have scoliosis throughout their lifetime. But all of them didn't live a relatively long life, so it probably wasn't type 2. Yeah, you can go to the next one. And then nausea, and then these are actually a really cool thing. These are called zebra lines, and that's from the injections that you get from the shots. This is them strengthening the bone, and it's like a tree trunk, and over time it grows on top of each other. So then when you look at an x-ray, it's all these zebra lines is what they're called. You can go to next. All right, so then this is COL1A1 gene, and then this is just the COL1A2 gene. These are the genes responsible for making collagen. And then this is autosomal recessive inheritance pattern, which is what we're going to get into next. It's how you inherit it in the first place. So how does one even inherit osteogenesis imperfecta? Well, scientists have found that answer, although a complete understanding of this would require more than the time we have available. In layman terms, as Medline Plus put it, many people with type 1 or type 4 osteogenesis imperfecta inherit a mutation from a parent who has the disorder. The simplest way to attain the mutated gene that causes OI is through one or both of your parents having it, whether asymptomatic or not. National Human Genome Institute writes, parents of a child with an autosomal recessive disorder are not affected, but are carriers of one copy of the altered gene. This is a rare occurrence for this disease, as it would require both parents to not be affected by the mutated collagen genes. In conclusion, although OI is a rare disease, it is present in many individuals throughout the world. They have many struggles within their lives, starting at birth and ending at death. This presentation goes over the fundamentals of this disease, such as symptoms, diagnosis, treatment options, and inheritance. Osteogenesis imperfecta has impacted many people's lives. Thankfully, we live in a world today where there are resources for everything and everyone to enjoy their lives to the fullest, no matter